Thank you very much, Nicola, and thank you for inviting me to participate in this meeting and to hear these inspirational speeches. And it would be very interesting for me also to hear the takeaways of the roundtables. There is, as a member of the European Parliament and as a member of the Committee of the Regional Development, I think we are at such a timely moment because we are transitioning to the next MFF period. And there is no doubt about the role of cohesion policy. You can go to the first slide. For me, there is no doubt about the role of cohesion policy to ensure affordable healthcare systems, to improve access to treatments and medicines, and to tackle the health inequalities within Europe. Regions and cities are close to the citizens and best placed to understand their health needs, challenges, and investments needed. And as a result, during the period 2014-2020, more than 7,000 health-related projects were financed through these funds. However, inequalities persist between member states and even between regions within the same member states, as you can see in this map. And not to mention the difficult access to medical care of rural and remote areas. And the COVID-19 crisis has evidenced this even more. It showed enormous differences among national health systems regarding preparedness and responses to the virus. We also learned the crucial role of the technologies and digital tools to combat the virus and the need to accelerate this digitalization process. The pandemic has also evidenced the importance of creating resilient healthcare systems and that more focus on healthcare is needed at regional and local levels. And you can go to the next slide. I think the European funds present a unique opportunity to do so. The cohesion policy and their funds for the period 2021-2027, in synergy with other funds such as Horizon Europe or EU for Health, should provide the basis to create resilient healthcare systems and to ensure equal access to health and medicines. And I think the structural funds are already playing a key role in our response to the crisis. In fact, as you can see in the slide, the first two initiatives, the Corona Response Investment Initiative, CRI and CRI Plus, are first example of this new focus at European level. They were launched last March by an urgent procedure in the European institutions to allow exceptional flexibility of the budget remaining in the ERDF and ESF funds to cover health expenses during the breakout of the crisis. And for example, only in Spain, through these instruments, we have allocated more than 1,200 million euros in COVID-related expenses. Of course, this was a quick response measure, but to create more resilient healthcare systems in the long run, we have the cohesion policy. We have the ERDF and the ESF funds and the REACT EU fund, which is a part of the recovery package. And the priorities for the next period should follow this new approach. We, as policymakers, have included express references to healthcare systems, which hopefully will be taken into consideration by the managing authorities when designing their operational plans. And next slide, I would like to point out the importance of cross-border mechanisms. The closure of borders and the national approaches followed by many governments during this pandemic has endangered something as basic as dear to us as a common European space. That's why I believe we should continue investing in interregional projects to find solutions to border challenges, harness inter-regional cooperation opportunities, and develop synergies to improve access to healthcare facilities. I believe that it's only through this type of projects that we will be able to overcome the silos approach and ensure the development of more integrated solutions. And as an example here, I show you the hospital of Cerdanya, which is managed now by the health department of the Catalonia government and the French Ministry of Health. I think this is the first hospital in Europe with double nationality. And next slide, the question is how to use the funds to make healthcare systems more resilient. It's sure that the funds must support the digitalization of the healthcare sector. As we have seen today, digital tools have the potential to innovate and improve access to health, quality of care, and increase the overall efficiency of the sector by offering more personalized assistance with lower operating costs. We have seen great examples today during the roundtables. And this includes the interoperability of medical record data, electronic prescriptions, and telemedicine care, especially in rural and sparsely populated areas, to ensure equal and quality healthcare, no matter where the patient is. And I think in order to be successful, European funds should focus on projects which take into account the opportunities, but also the challenges that digitalization presents. And I have just put 4 in this slide. I would like to highlight 4 topics. The first, as we talk today, the digital upskilling of healthcare professionals is essential. We need specialized technicians and researchers, not only in disciplines such as artificial intelligence, computing, or cybersecurity, but also in data protection and legal requirements that are demanded on health technologies so that can be applied to patients. We have to invest in continuous learning, because if we want to make sure healthcare professionals use these new technologies and maximize their potential, they have to understand, to use them, and to trust them. And in this case, projects supported by European funds in the next period should take into account these training needs and promote, and I don't want to forget this, to promote also the role of women in digital technologies, where there are 4 times as many men as women. Second, the digitalization process must necessarily be based on access to data and interoperability at European and regional levels. Funding projects that promote common data infrastructures and requiring that funded projects adhere to the principle of interoperability and open access to data are some examples of how European funds can promote digitalization in health. I think the development of good practices for access to data between different regions is paramount here. Third, support for digitalization is also support for innovative technologies that underpin it. Artificial intelligence, mass data analysis techniques, blockchain, or cybersecurity are technologies that should be promoted from European funds. Research based on cooperation in these areas between the regions and public and private agents must be a priority if we want to make healthcare digitalization a reality. And these projects not only boost R&D, but also encourage interregional cooperation in these areas and the balanced development of technical capabilities of European regions. And 4, the process of digitalization will not be rapid or complete without cooperation between the private and public sectors. Both areas have much to contribute to the digitalization process. On one hand, only the public sector is capable of providing access to data generated by health systems and the necessary large data infrastructures. Moreover, public research is essential to advance new discoveries in these new technologies. But also the private sector has the tools, technologies, and capabilities to efficiently exploit the data and to undertake the technological development necessary to transform advances in research into new treatments and health services for citizens. So I think European funds must encourage the collaboration of academia and industry in the process of health digitalization. And I want to finalize. In summary, people, training healthcare professionals, open access to data and interoperability, commitment to cutting-edge technologies, and public-private collaboration are the main vectors for promoting healthcare digitalization. We must ensure that the cohesion and territorial cooperation funds support projects in these priorities, while respecting also the regulatory, legal, and ethical principles which we, Europeans, have endowed ourselves. The digital revolution is currently helping to generate the health treatments and services we will enjoy in the future. And in this sense, the European funds, if well used, will be able to make a decisive contribution to the health that we, Europeans, will have in the coming decades. That's our main aim as politicians, and that's what I would like to contribute to in the next years. Thank you very much.